Hi, I'm Dr. Gary Sachs, and I'm here with Theresa Schmidt, nutritional therapist here at Sachs Wellness Center. We've been getting together to talk on topics that we're hearing, questions that we're getting from our patients, and today we thought, even though the snow's been coming the last couple days, still it's the time when allergies start to kick in. People feel them a lot more now and in the fall. So this time of year, for not an unknown reason, but still, it starts to increase quite a bit. So what do you think is causing all this?
Well, basically what's causing it is, we were just talking, some people think it's just because they live in Michigan or they live in northern Michigan. It isn't Michigan or northern Michigan, it's the immune system itself. It's the person's immune system that is not functioning correctly and as well as it should be.
Yeah.
So
if you live somewhere else, it'd be something else that would be.
Yes, it would. If you were there long enough, you would develop sensitivities to something there too.
Yeah.
So sometimes it's helpful to understand the mechanism of why that's happening. So I thought maybe we'd hit on that a little bit. When we have not a good immune system, not a great immune system, we can tend to overreact. Our system overreacts to things. So when we do encounter a toxin or even a pathogen, but a toxin like we're talking about, like pine pollen or mold under the leaves, things like that, when we encounter that after the winter and we've had no vitamin D for 7 months, the immune system gets weaker and weaker. And so when we come across that type of thing, we can't fight it off as well. So it isn't the mold, it isn't the pine pollen, it's our immune system just isn't as strong as it should be. Yeah. So
we tend to blame the mold, we blame the pollen, but but we can't do anything about the mold and the pollen, but we can do something about us.
Absolutely, absolutely. So a couple of the things that influence our reaction to those things, one of the big ones, as far as I'm concerned, is the leaky gut situation. That means there's little gaps in the cells in the small intestine, and things, partially digested food, good bacteria, bad bacteria, and things we swallow can leak through those the openings in the gut wall, and those things don't belong there. They're not us. They're not us. So the body sets up a reaction to that to try to help us get rid of it.
As it's supposed to.
Yes, exactly. And so that reaction, depending on how much leaks through there, that reaction can get worse and worse as it encounters that thing again. And what people don't think about is when that pine pollen is blowing off those trees like a rainstorm, we breathe that in. It gets in our saliva, and we don't just get it into our lungs and our sinuses, we get it into our gut. And that pollen will leak through the holes in the gut and set up an autoimmune reaction. So the next time we breathe it in, we get a reaction.
You know what's really interesting is that, even going into applied kinesiology, something that we use for chiropractic care, always for decades, when people would complain about sinus problems or any kind of mucus issue, we always said, yeah, but this is coming from your small intestine. And people have the hardest time understanding that even it's coming in for an allergy problem, we may be working with your gut. We're not going right after the congested things that you're feeling, or even the symptom that you're having. We're going at what's causing it.
Exactly. There are things we can do about the allergic reaction. We can help the lymphatic system clean that up quicker. We can help not respond so much. Allerplex is a really, really good product for that. Echinacea C, really good products for that. But we want to get to the cause of it. And if it goes on long term, you're not just allergic to pine pollen. Now you're allergic to maple trees, and then you're allergic to this thing and that thing, and it just builds on, and you don't have just spring allergies. Now you've got them in the fall. And then you have them all summer, and then you have them all winter. So
and if you take anything, whether it's a supplement or you take something over the counter or you get a prescription and it's aimed at helping that symptom, as soon as you stop taking it, you still have the problem. You didn't get to what caused it.
Right. And the body is giving you a symptom to tell you something's wrong. So not that I want people to be miserable, that's not the point, but you cannot just address the symptom. Otherwise, like you said, you just keep taking stuff and more stuff.
We want to
learn
make
more
it comfortable, but we want to make it so you don't have this
things. Yeah.
coming back
Exactly.
at you. So.
The other thing that I do look at when I'm looking at somebody with allergies is I look at their reflux issue, see if they have a reflux problem. With reflux, we actually breathe up acid, sulfuric acid from the food that's rotting in the gut. So it's not stomach acid we're talking about. It's actually sulfuric acid from the food. And when we breathe that up quite a bit, and especially at night, it inflames the tissue in the sinuses and in the lungs and in the bronchioles. So you already have inflammation in there. Then you breathe in pine pollen, or you breathe in something else, and you are already set up for reaction. That's the same thing with a cold, though. If you're already set that way, and you run across a bacteria or a virus or something, you're already weakened in that area, more vulnerable in that area. So you tend to get colds more often or bronchitis more often.
Yeah.
If you get a cold, it's worse.
Sure.
Thing. So
just think about you've got tissue that is inflamed, it's sore. It's the perfect setup for an overreaction to something. You know, it just if you think about if you had a sore arm and somebody brushes right where you're bruised or it's already inflamed, it hurts a lot more than if you didn't have the bruise.
Exactly.
And and it's like that. It's just tissue inside that becomes sensitive
and vulnerable.
Yeah.
I mean, that tissue can't block a pathogen. It can't block those things that are coming in to attack it or to bug it. You know, it's not healthy tissue to protect itself.
No.
So it just becomes more vulnerable. So we become more vulnerable.
Yeah. That's great.
So,
Great.
It's good information.
So if you're somebody that has noticed things coming at you, soon, spring and fall, really now's a good time to start working on what's causing it, what's behind it. Give us a call or get on our website. We're at 989-732-7000. Our website is www.sacswellnesscenter.com. Coming up in a future talk, we're putting together some information on how to help people that are about to get a vaccine for COVID, to help them do some things that would reduce the chance of them having a reaction to it, and also things to help you if you do get COVID, and things to do in case of, it's your decision whether you get a vaccine or not. What we want to do is help you stay as healthy as you can either way, whatever your choice happens to be. So stay tuned.